Okay, good morning. And so we are going to start with the preparation for our NCCOM herbal prep. And so this is the session that we are going to talk about from two main aspects. One is talk about from the single herbs, and another aspect would be our formulas. So in the NCCOM board exam, this is the one that we are having a herbal study guide and from NCCOM. That would be our main resource would be used and for the study of this class. And so I'm going to do a share screen here. And you can find this information also on Brightspace and has been already uploaded. So the edition you see here of the herbal study guide started in January 2020. And so there are different domains and aspect being required from the NCCOM. The domain one, this is the one that focused on safety and quality of the Chinese herbs. It takes about 10% of the exam. And so the safety aspect we can see here that need to be cautions of the contraindications of herb and herbal formulas. So for example, any allergies and or relevant pattern syndrome differentiation. So this is the one that is especially related to gluten intolerance. Like what kind of herbs or formulas may contain the herbs regarding to gluten issues. For example, a shenqu, right? This is the from food stagnation in eliminating category. And also the formulas contains shenqu, has possibly allergy related issues. And also, if anybody has allergy regarding to soybeans, we have 蛋豆豉, right? So this is the one that are also related to soybean. So these are the allergy issues that potentially could happen. And then we have herbs that has already noted with small toxin, if they're going to cause nausea, vomiting, or like herbs harshly expellant or purgatives, they can cause diarrhea, loose stool. So these are the potential cautions or contraindications needs to be aware of. And then the next one, we have the herb and supplements and any pharmaceutical interactions. So we need to also recognize herb drug interaction. Usually we say the herbs that with the English name started with G are the one that often have a lot of like contraindication, or Chinese name with G. So for example, ginkgo fruit and the ginseng and gancao. So these are the ones that usually would have contraindications regarding to a different category of the herb drug interactions. So those are the parts that may take also a part of the information. But from drug aspect, usually would be tested regarding to anticoagulant and related to our blood movers. So like Coumadin, warfarin, this type. And then we are also having the need to recognize the potential adverse effect and toxicity that would regarding to the 18 incompatible, 19 antagonism. So this is the one I know some of the herbs we don't even use nowadays, but unfortunately, these are the ones that, what are the 18 compatibles? what are the 19 antagonisms needs to be remembered, and especially regarding to the herbs that are very commonly used. So such as like what we have talked about, 甘草, incompatible with 海藻, right? So both of them by themselves, they don't have any particular toxin, but when they get together, they becoming the ones that are incompatible with each other, the antagonism with each other. And so that's the ones that we need to remember. And then the next part regarding to the safety and quality, this is the one, identification. That's regarding to herb lab info we have learned before. There would be questions coming out, give you what would be the following description, the most accurate or correct to describe 半夏. So it's light yellow color, round shape, and accurate, or they would give you its cubic shape, its brown color. So that's the one regarding to our herb identifications. So those are the ones that also going to be mentioned. And also here mentioned about that you need to recognize endangered species. So like any protected animals and or any herb ingredients, especially here talking about animals that we are not be able to use, such as 犀角, right? And so, and even 羚羊角, these are the protected animals. And then CGMP, this is the one that is so far we don't have that many involved in the board exam, but it's being listed as a requirement, just like from the manufacturer practice aspect, that we need to have a concept and that we are adapting the CGMP into our field and our herb product patents. We need to recognize CGMP as the product for the herbal products. So that's just like need to have an idea about it. Then the next one would be following FDA requirements. We do following FDA requirements, which is the one that are under the food dietary supplements category, and the storage, and we need to also checking about make sure no mold and no contaminations. And so that's the safety part, takes about 10% of the exam module. The next domain would be the majority part, takes 70% of our exam. So this is the one that regarding to treatment planning and strategies. So that's the one that we have Chinese herb recommendations based on assessment. So that's the one that we need to have a good idea about our TCM foundation diagnose and also herbal information. The first part is regarding to our single herbs. And so we are going to go through the required single herbs from NCCIM also. So under these single herbs, we need to know about their properties. So that's including about what's their temperature, flavors, channel tropism, and also what's their actions. So that's the basic information needs to be memorized and required regarding to the single herbs. And then, so these are the ones that the functions would be important. So the functions and indications. And so identify what would be the functions. So like, does this herb release exterior wind cold, or is this one clearing heat and cool blood? So what would be the functions and indications? And that's also, we find out that the most complicated or difficult part regarding to single herb reviews, because the herbs has more than one, most of the time, more than one functions, which makes it a little bit complicated and difficult. And also the effect of 炮制. So that's the one we learned: honey fried, dry fried, vinegar fried, liquor fried. So what would be the function and indications of 炮制 and make the differences? So we know that 炮制, this is the one that honey fried would enhance the lung tropism and help eliminating phlegm, and also enhance the harmonizing and for the herbs. Then vinegar fried and enhance the entry into liver, enhance the pain relieving. So these are the 炮制 indications that to the actions. And then we are going to apply the single herbs based on presenting signs and symptoms. In the board exam, they usually would have the question based on a patient or case already diagnosed with certain TCM syndrome pattern and has already been prescribed a formula ABC. Now the patient has new symptoms, additional symptoms coming out. Based on this new additional symptom, what would be the most appropriate herb? So that's another way to test about the single herb actions and information. So the next part would be 对药, pairing herbs. So that's the one that we find out that in TCM herbal using, a lot of times some of the herbs are very commonly show up as 2 herbs together, 3 herbs together, such as 陈皮 and 半夏 for phlegm, right? And 人参 and 白术 for tonifying qi. So these are the commonly used pairing herbs, and those are the ones that usually has already been put it in some of the commonly used formulas. So that's the 对药. And then we have the common herbal pairs apply on the syndrome pattern. It's similar like the one I just mentioned about in the single herbs, that they would give you a case with the syndrome pattern with the formula, and now they have additional symptoms coming out. Then you're going to choose the most appropriate herbal pair or herbal groups. So that's another way to test about it. And treatment strategies, and so to choose, it's similar like the case-based. Then herbal formula, good thing is that we have a list of formulas to focus on study, and that's the one that would be in the later part, also in our reviewing, in this reviewing class. And so we need to have a different aspect to address on the herbal formula ingredients. We need to know about what are the herbs contained in the formulas. In general speaking, I would say if you don't have enough of time or not be able to cover all the formulas ingredients, but for those formulas have 6 and under ingredients, please get familiar with what are the exact herbs inside it. 6 and under. So if they only have 4 herbs or 2 herbs in this formula, it'll be a good idea to know what will be the ingredients. And also, this is the one that we also need to have an idea about the relationships. And that's the one we analyze during class. What would be the key, especially the chief ingredients. So that's what we have mentioned about like each chief or minister or adjutant or guiding herbs. Each formula required on the NCCOM know about what's their chief ingredients, what's their king herbs. Sometimes that we have special of the herbs that, for example, we have the deputy or adjutant that has a special effect. And we have the one that when we were mentioned about the adjutant actually has the opposite action, comparing with other ingredients and trying to guide the herbs into the formula. For example, patient has extreme cold interiorly. Our warm herbs that not be able to get in. So in this kind of case, that we are going to using a super cold herbs such as pork bile, 猪胆汁, and to guide the herbs get in. So this is the one that very special and usage of the adjutant. And of course, we need to know each formula's function and indications, which means that what's their action? Are they clearing heat formula, or are they expel wind formula? And then what kind of pattern they are treating for? Are they treating the patient with liver kidney yin deficiency, liver yang rising, or they are treating patient with qi and blood stagnation? And so this is the important part we are be able to identify. And so same thing, a lot of times that it's going to be a case and you need to analyze the case, diagnose, give the differentiation pattern, and then choose the correct formula for the case. So that's the one that more combining all the knowledge we have learned from our foundation diagnostics and herbs formulas together. It's a more complex type of exam. So this is the one that we need to identify the actions. And the same thing with the treatment strategy. We are going to apply the formulas to cases. And then preparation. Some of the formulas are decocting into liquid form. We have some of the formulas grind the herbs into powder, which is supposed to be quick result. And some of the formulas require special preparations on the herbs. For example, if we have foods, aconite, this is the one that needs a longer cooking time. Or if we have any aromatic ingredients, which needs to be at a later time. So these are the information also needs to be mentioned. And so then any dosage application. So that's the one that including actually single herbs. If we have any special dosage, for example, some of the herbs that like Renshen, when rescuing life, needs to be large dosage, or some of the herbs we need to be aware about the dosage, like Xixin, should not be over 3 grams per day per adult. So this is the information also needs to be applied. So this is the main module for our the herb exam. Then the third domain takes about 20%. So this is the one that for patient management, definitely this is the one that case related. And so be able to evaluate the case and also combined with biomedicine, acupuncture, even psychotherapy treatment, if we are having any recommendations, referrals, or patient consider about their biomedical condition or the postpartum patient, if they have been receiving diagnosed with hypertension, if any herbs would be contraindicated. So these are the one that would be more close to our clinical practice. And then patient education. So give patients idea about the benefits, what would be the adverse reactions, how to preparing, taking the herbs. So all this information. And then if any follow-up evaluations, dietary therapy, right? Exercise, if there is anything that needs to be aware during the treatment. So for example, if we are clearing heat and the patient need to avoid having alcohol beverage, spicy food, or patient with getting diagnosed with the middle jiao yang-qi deficiency with cold, and we need to avoid any raw cold food. These are all the information needs to be aware. So it's a patient-centered, complete treatment, not just like only focused on herb. Herb needs to be applied for treatment. So these are the 3 domains. It'll be a good idea that we have a good idea what does the board exam test for, and what are the information we need to prepare for the exam. So that's the one that already been given on this study guide. So then we are going to come to the part where I have mentioned that we're going to have 2 main aspects to focus on the reviewing for our class. The first would be our single herb aspect. For single herbs, definitely the NCCOM required book, textbook, or required the reference book would be Bensky's Materia Medica. And this is the one that for AOMA students, we do have Dr. Zhou's book, which has been the one used in our single herb study. And Dr. Zhou's book is more like the condensed version of Bensky information. So that's a good book also for put it into review. And so no matter which book you're going to use, before we come to each individual herbs on here, my suggestion is that first look at the content page on your book. So that on Zhou book maybe take about 3 pages. So that's the one that give you idea what are the structures inside our single herb book. So we can see that on the Zhou book, this is the one we have. So the table of contents on your Zhou book may take about 3 pages. So first to have an idea about what would be the chapters we have. So like release exterior, clear heat, downward draining, all these. So, and like first we are going to have a file cabinet. So we would know, what are the labeled of like these 4 or 5 drawers. And then we're going to look at what will be the sections under each chapter. So like release exterior, we have release wind cold, release wind heat. So those are the structures that we have studied in our herbology single herb class. And then in each drawer, what would be the file folders, right, with the labels. And then under each section, what are the herbs? Know the names under each section. So like Ma Huang Gui Zhi, Zi Su Ye, these are the one that in the release exterior chapter under the section of release exterior wind cold. So first have entire structures of this table of contents, and then we would know which category do they go. When you know about all this information, you actually already have some of the basic information regarding to single herbs, because release wind cold, then this is the herb accurate and warm in nature, right? And also you would have the basic function of this herb. They are releasing wind cold. So this is the one of the information I would suggest that we first be able to go through and be able to cover it on that part. And then we are having a whole idea of the table of contents. And then the basic information on the beginning, like the introduction part of the herbology. What will be the basic temperatures of the herbs we have? So hot, warm, cool, cold. We have some neutral herbs also. And come to each individual herb, some of them has neutral flavor, a neutral temperature. And that's the one that we need to be aware of because there are not that many. And these are the ones that be able to use both heat or cold patterns. And then the flavors. What are the basic 5 flavors and their related functions? Because a lot of herbs that if we have the exam questions that regarding to what will be the flavor of the herbs, if you don't know at that point, but you can analyze through their functions, right? Because acrid flavor disperse and move. So if moving qi, moving blood herbs, they have a higher possibility of having acrid flavor, right? And also sometimes that in furthermore analyze, there would be questions about what would be the following flavor herbs should is cautious or contraindicated for qi deficiency pattern. So how can we choose an answer of flavors regarding to not using for qi deficiency? That comes to the aspect is that acrid flavor herbs moves qi. When we move qi, it has the potential consume qi side effects. So that's why acrid flavor would be the one that not suitable, contraindicated, be cautiously using for qi deficiency pattern. That's how the answer would be chosen. And then sweet flavor, this is the one that has the action related to it, be able to tonify, harmonize, moisturizing. And then we have our bitter flavor, be able to drain and dry, and sour flavor, astringent, prevent any leakage. Salty flavor, this is the one that be able to purge and soften. So that's why xuanshen, this is the plant-based, it's not seafood-based, and be able to soften hardness because it has salty flavor. Or in another word, if they ask what would be the flavors that correctly describe about xuanshen, you would choose salty flavor because it's be able to soften masses, soften hardness. And so, and we have also a very special one is bland flavor, mainly related to drink dampness. So our yiren, right, fulin, these are the ones that promote urination drink dampness category herbs related to bland flavor. And also we have our the channel tropism compatibilities. So just now we've already mentioned about what are the 18 incompatible, and Gancao has a one group, and our aconite Wutou Foods has one group. Li Lu, although we don't use it, but exam would also ask you about it with the incompatible with Li Lu. Most of them are our shen herbs, right? Ren shen, sha shen, dan shen, ku shen. So those are the one information you can find it on your introductory sessions of Bensky book and your single herb book from Dr. Zhou and Dr. Hamilton. And then 19 antagonism, that's the one that also related to it. So these are the information introductory aspect we need to first to know about it. And so the next part that we are going to start with the reviewing is our single herbs. We can see that on the NCCOM study guide, this is from their name, pinyin name, alphabetic. So on your exam, you're going to see the herb names are going to be shown with pinyin name and their Latin binomial name, like the one you see right now. And so this is the one that same thing about formulas. They would have a pinyin name, Chinese pinyin name with their English name. Okay, so the first one that we're looking at here, this is ai ye. So ai ye, just like I've mentioned, first we have a good identification of the structures. Where does the herb comes from? And so ai ye, this is the one that we learned from stop bleeding category, right? And then this is the one that under the category of warm meridian to stop bleeding. So from here, we can see that we are be able to identify the temperature of ai ye. This is the one that with warm nature. And also this is the one that be able to stop bleeding. And so it's the herb that warm meridian stop bleeding. That's the main action. And also this is the one that used for gynecology, regulating menses, relieve pain, and calm fetus, be able to calm fetus. So that's why we have one of the formula contains with it jiao ai tang. It's required in the formula part, contains ai ye, dealing with a patient who has cold uterus with miscarriage signs. And also it is the one that be able to use topically and eliminating dampness because it's accurate, right? Be able to aromatic, transform damp, and stop itching. So it's the one that also be able to use to decoct, make into herbal bath or herbal wash. So this is the first herb, ai ye. And so that's the one that we also make our moxa from. But the moxa is especially using the fur on the surface of ai ye. It's not exactly the same as the folium, the leaf we used as the herbology here. So the moxa we used is the fur. So this is about ai ye. The next herb, ba ji tian, same thing. After we reviewed about the content of the table of contents, and we know that ba ji tian is coming from the tonifying category, and it is the one that under the tonified yang category. So from here we can have a basic information regarding to ba ji tian. Then this is the one that be able to tonify yang. And also this is one of the herb be able to so tonify yang, we also have the aspect focused on tonifying kidney yang. So then we also use it for a patient who has infertility, ED, and regarding to kidney yang deficiency patterns. And also this is the one eliminating wind, damp, cold, strengthen bone and sinew. That's why when we are treating patient who's having wind, cold, damp B syndrome, joint pain, arthritis, biomedicine diagnosed with osteo or rheumatoid arthritis, and so we are be able to use ba ji tian. So this is the ba ji tian. The next herb, bai bu. And so this is the one that first identify the category Baibu comes from Resolve Flame. And this is one of the herb coming from the category of flame eliminating and with relieve cough and wheezing. So Baibu, this is one of the herb. When we talk about first, we need to be aware about the slight toxicity. And so that's why when we are using Baibu topically, we use the slight toxicity to expel parasites, kill lice. So as a topical wash, And then for the stop cough and wheezing aspect, we usually would using one of the powder form, honey fried, to moistening lung and stop cough, And so this is Baibu. We need to be aware about the toxicity used for topically, and also orally taking, we use honey fried to enhance the lung moisturizing stop cough. The next one, Baidoukou. When identify the category, it is the one that coming from the aromatic transform damp category. So this is the one we have mentioned in the 4 ginger family, botany family herbs, right? 白豆蔻, 砂仁, 草豆蔻, and 草果 from the same category. And they have very similar actions and degree differences. And so for 白豆蔻, this is the one that very gentle and aromatic, transform damp, and also it's the one that focus on needle gel. And that's why I've mentioned that a good idea to know about the category it comes from. Aromatic transform damp or focus on needle gel dampness, spleen and stomach needle gel dampness. And so 白豆蔻 also be able to regulating needle gel qi, And then it's the one be able to warm needle gel, stop vomiting. Warm needle gel, stop vomiting. And so for a patient that who has needle gel cold, we can use 白豆蔻 to eliminating it. And so sometimes that, like I mentioned, other herbs name from the same category, like 砂仁, like 草豆蔻, 草果. Then later, when we mention about 砂仁, we would also refer back. So just to bring the connections between the herbs. And when we are studying the single herbs, are using the structure of the categories based on function. Right now, we are just go through the list from our NCCOM requirements. These are the two aspects of review can enhance each other's. We can also get information from our table of contents from our herbal book, herbal study, and also we go through the herbs required from NCCOM. Okay, and then 白果. This is the one that we have learned from the astringent category, stabilize and bind. Oh, sorry, 白果. This is the one we learned from the resolve flame category, and be able to relieve cough and wheezing also, and also it can bind. And so this is the one that we have the ginkgo fruit. This is the ginkgo fruit. Same thing, ginkgo fruit has toxicity. It has slight toxicity. And so we need to be aware about the toxicity is addressed on our central nerve system. And it is the one that can cause a patient having the itchy skin, or tightness in chest and shortness of breathing. So these are the side effects or symptoms can be regarding to the slight toxicity of the ginkgo fruit, Baiguo. And so this is one of the herb that be able to stabilize lung qi, stop cough and wheezing. And also it's the one binds the discharge. And here, especially regarding to lower orifices discharge, such as vaginal discharge used for patient that has large quantity of leukorrhea or patient who's having spermatorrhea. So lower orifices discharge, we usually would use Baiguo. So that's why you will find out that in gynecology department that when we are treating patient that has spotting or who's having large quantity leukorrhea can be due to various issues we are having Baiguo in it. And so this is one of the herb that we need to be aware about the toxicity and do not use too large of the dosage, although on our recommended dosage is 4.5 to 9 grams. Okay, the next one we are having is Baihe lily bulb. So Baihe, this is the one that coming from the category of tonifying and nourishing yin herbs, from nourishing yin herbs. So Baihe lily bulb, this is the one that focused on lung and heart. So from here we can see that it is having the aspect focused on lung to nourishing lung yin and stop cough. And also it is the one that focused on it is the one that focused on heart and be able to calm Shen. And so these are the two aspects related to Baihe. And it's the dietary based ingredients. So that's why it is the one that we are also be able to use it to make soup or congee, The next one, Bai Hua She, which is the snake. So this is the one that actually my suggestion, recommendation to NCCOM is that I need to change the official name of this medicinal, because Bai Hua She is not the really accurate official name. We nowadays just call it Qi She, QI, Qi She would be more accurate, because just use the name Bai Hua She, there are so many wrong and fake or species has been used. And so this is the snake, and coming from the category we under the wind damp eliminating, and so belong to the relieve cold wind damp. And so it is one of the herb that we have, one of medicinal, not herb, because it's snake, pretty strong in the effect, and be able to, that's why we use powerfully, unblocks channels, expel wind. You know, snakes are the one that, I know this is may not be the most way we use for comparison. You know, when we have a sink blocked, we usually plumbing wise, we would use a plumbing snake to dredge it through, right? And so in our body, our channel blocked, we have a snake to be able to dredge it through open. So it's very powerful to open the, unblocks the channels, expel wind, and to use for wind regarding to dermatology aspect, stop itching. And also it can be used for tremors or convulsion. So internal wind, or used for any exterior layer of the wind. So this is one of the very strong ingredients would be used. The next one has the very similar name and can be easily get confused due to the similar name, 百花蛇舌草. this is a grass. This is a grass, which is the one that coming from the category of clear heat and relieve heat toxin category. And so 百花蛇舌草 nowadays is more addressed regarding to the anti-cancer study. So that's one of the ingredients has been addressed for various type of GI, especially GI category cancers. And so it's the one that coming from relieve heat toxin. And so dermatology also used a lot, such as heat toxin manifested as skin pimples, acne, or it can be also used for promote urination relief, painful urine disease, such as dealing with jaundice or any heat Lin syndromes. So that's the one that 百花蛇舌草 has been used. But nowadays, that are more addressed about the anti-cancer effect of 百花蛇舌草. The next one, 百吉, and it's coming from the category of stop bleeding, and under the section of stop bleeding and astringent category. So 百吉, this is one of the herbs be able to astringe and stop bleeding, and also especially nowadays focused on lung and stomach bleeding issues and generate flesh. For example, any ulcerations. And so 百吉 can help with the healing process of ulceration. So that's actually one of the aspect of 百吉has been used. And so this is the one that 百吉. The next one, 败姜草. So it's coming from the category of clear heat and also under the clear heat toxin category. So 败姜草, this is the one of the herb. The Chinese name 败姜 actually means rotten fluid, and that's highly associated and related to abscess. So it's one of the herb that be able to clear heat toxin, eliminating pus related to abscess. And it can be abscess related to like endometriosis, gynecology related. It can be abscess related to intestines, such as nowadays used very often in the ulcerative colitis. And so another aspect of the function 败姜草 has is be able to disperse blood stasis and stop pain. So that's the one that we can use for any pus plus with clots with a stasis. And it can be used for postpartum. After delivery, there's a lot of stagnated blood, and 败姜草 can be used for eliminating those stagnated blood. So this is 败姜草. And just now I have mentioned it for postpartum. So it's cautious for pregnancy. We don't want it to move the blood during pregnancy. We need to hold, right? And so this is the one that is cautious for pregnancy. The next herb, 白芥子. 白芥子, this is the herb that actually under the flame eliminating category belong to the flame cold treatment. So it is pretty warm in nature. So 白芥子, this is one of the herb be able to warm lung, expel flame, and also it is the one that be able to use for dissipate nodules, regulating qi dissipate nodules. And there is one of the aspect that can be cautious or can be usage part, because this is the one that is very accurate. Topically put it on skin, it can cause blisters or burning. And so it's the one that we do use it as a herbal patch to stimulate acupuncture points. And but also that's something that topical using can cause burn on the skin as a cautious aspect. And it really kind of like have a little bit differences in regarding to the practice in China and in the States. So for example, in states that we don't have malpractice insurance covers anybody using Baiji's topically on your patients causing burn. While in China, it's actually one of the nowadays pretty commonly used method and to stimulate back shu points and to treat, we call it treat the winter diseases in summertime, which has been introduced in some of our classes before. So this is 白芥子. The next one, 白茅根. So this is one of the herb that we have learned in Stop Bleeding under the section of Stop Bleeding, Cool Blood. So from here we can see that it is the one that with cooling property, right? It is the one that be able to cool. And so 白茅根, this is one, we know that usually we are going to charge the herbs to enhance in this stop bleeding category to enhance stop bleeding. 白茅根 is the one that just no need to be charged. It's already cool blood, stop bleeding. And also this is the one that be able to promote urination. Very commonly used for a patient who has Lin syndrome with heat type, bloody Lin type. And it is the one clear heat from stomach and lung. So that's why you would find out that a patient has stomach heat, nausea, vomiting, we would use it, or thirst. And also when patient who has lung heat type of cough, we also use 白茅根. We also use 白茅根. And it is the one that in Cantonese area, it's one of the very commonly used beverage tea, 白茅根 tea. It's the one for summer season, during the hot season for clear heat and eliminating dampness. So that's actually another dietarily using can be applied for 白茅根. The next one, 百钱. So 百钱, this is the one that coming from the category of resolve flame. And also it is the one that for flame heat, I'm sorry, 百钱 for flame cold eliminating, flame cold. So 百钱, this is one of the herb pretty gentle among the category. So it is the one focused on disperse lung qi, expel flame. So that's why we would find out that a lot of times that we would using 百钱 in the pediatric treatment. 百芍, this is the one a lot of times that we are going to talk about it with our 赤芍. It's on the same page here, right here. And so peony root, and 百芍 is the one that processed peony root. And so this is one of the herb coming from the category of tonify, and which is under the tonify blood category. So 百芍, this is one of the herb that we have for nourishing liver blood, especially liver blood, and regulating menses, and also be able to calm liver. And this is one of the herb often paired up with chaihu to calm liver and relieve pain, relieve spasm. Calm liver is usually combined with chaihu. Relieve pain is usually combined with gancao. And so we have the formulas such as 逍遥散, right? That's the typical example. 白芍 with 柴胡work together to calm spasm. And then we have the 芍药甘草汤 we learned from Herbal Classics. It is the one that to calm spasm, relief pain. And this is the one be able to nourishing yin. And a lot of times that we are going to using dry fried method, make it into 炒白芍 to enhance the nourishing yin effect. And also this is the one that harmonize yin and wei. That's in the combination with 桂枝, right? 桂枝 and 白芍combined together are the ones that be able to perform as harmonize yin and wei. The next one, 白头翁. This is one of the herb coming from the category of clear heat, and also it is the one that under the heat toxin clearing category. So when we are talking about 白头翁, a lot of times that it would be first jumping into the mind is patient has dysentery. And so this is the one that such as the amoebas type of dysentery. And so it is focused on intestines to clear toxin and cool blood, stop bleeding. And we have a formula named after it, 白头翁汤, right? So dealing with bacterial type, and the patient has pus and blood in the stools. And also it is the one that used for kills parasites, stop itching. So that's the one used as an external wash. And we usually use it in the gynecology department, that using 白头翁decoction as vaginal wash, and for patient who has trichomonas. So this is the one that also topically can be applied using 白头翁. So it is the one that internally would be treating dysentery or malaria type of diarrhea, and then topically can be used for any topical itching or parasitic issues. So this is 白头翁